I'm telling you, it's not the law, it's the lies. Forget about Republicans sticking a syringe in the health care law. Democrats, and a lot of their broken promises, are sticking a syringe in the health care law. Let's review. Roll the tape.
If you like your doctor, you'll be able to keep your doctor. If you like your health care plan, you'll be able to keep your health care plan.
Sorry, it's a lie. We all know how that turned out. You couldn't. Proceed.
And that could save families $2,500 in the coming years. $2,500 per family.
Not quite. Saving us money between soaring premiums and penalties. This law is costing us a lot. Continue.
And millions of Americans without insurance will get coverage through these programs. So that's what the Affordable Care Act is.
Okay, so he says this law was meant to insure millions of Americans without insurance. I got that. But that is not what Obamacare architect Jonathan Gruber had been saying when he told me this not too long ago. If we had 30 million in the end who are uninsured, was it worth it?
Absolutely. Neil, this is if
really?
we cover half the uninsured American, it would be the greatest expansion of
insurance. I thought we were going to cover everyone, Jonathan.
History.
The whole idea cover everyone.
No one ever claimed we were covering everyone.
Jonathan, I thought so. Everyone
no one ever did.
Who So, who is, I don't know, lying is strong, maybe misrepresenting the truth. Certainly not Nancy Pelosi, who says the name Gruber does not ring a bell.
I don't know who he is. He didn't help write our bill. And so, with all due respect to your question, you have a person who wasn't writing our bill commenting on what was going on when we were writing the bill. Let's put him aside.
Our bill brings down rates. I don't know if you have seen Jonathan Gruber of MIT's analysis.
You said you didn't know Jonathan Gruber. When the law was being crafted, you knew Jonathan Gruber. Okay, to neurologist Jeff English, who says, this is why Americans are so down on Obamacare. The people who were behind it lied. Doctor, good to have you. What do you make of all this?
Well, thanks for having me on. As usual, I would first like to say the American people are not stupid. As you're well aware, unless you spend a lot of time or you're in the healthcare industry, you understand business, you understand economics. This is a very complex situation, complex system that most people don't understand. And I would argue, having spoken to many politicians as you have, that they didn't understand it either because the majority of them don't run businesses and didn't work in healthcare. So none of this is unforeseen. It's very complex, yet we trust them to write legislation that will safely affect 300 million American people, and that's obviously not what happened.
All right, well, you're a very trusting person, but I think they did know, Doctor. I think that they knew exactly what was in it before they voted on it, and they just didn't want us to know about it because one promise after another was broken. The doctor thing, everyone would be insured. Now it turns out 30 million won't be, and that was what their intention was all along. We have no problem with it, and on and on and on. So given that, and the fact that Americans are now come to appreciate that if it sounds too good to be true, it probably is, can they fix this thing?
It's going to be very hard to fix. And first of all, I would correct myself. I would say that I agree with you. The people that actually drafted the law understood the law.
Right.
But the people who voted on the law didn't understand the law.
But
Doc, I'll tell you,
of them. I'm sorry. So here's what I discovered, and I'm not nearly as smart, certainly on this stuff, as you will be in 1,000 years. So what I knew is that if when they were talking at the time when they were cooking this up, that every American was going to be insured. They mentioned nothing about people not being insured. It was to insure the 30 million that they're dismissing now. And the fact that everyone would be covered for pre-existing conditions. And again, I stepped back and said, well, if we're not all going to pay for that, there's no way the math would favor that remaining the case. So that alone said that it was way too generous to think that we wouldn't generously pay for it.
Oh, I completely agree. I think, we understood the last time you had me on, we talked about the fact that year one in the Obamacare exchanges was really just a matter of, it really was all about signing people up on a website. It didn't have anything to do with health care. Now year two, we're dealing with taxes, mandates, and higher costs. So now the American people are really going to get a rude awakening in ways they will all understand when it comes to their pocketbook and things they have to pay for. I mean, it's going to be a tragedy tragedy some of the things we're seeing with patients have no access to the physicians. You know that Atlanta has been in the healthcare international news because of the great care Emory has done with Ebola. Well, I'd like you to know that in Atlanta, the majority of the large healthcare systems don't even accept patients on the exchanges. So just having a card that says you have insurance doesn't give you access to care. You've got restricted medications you can use. You can't see your doctor.
Very big deductibles.
And the costs,
very big deductibles.
The costs are so high they can't afford to even come see the doctor.
All right. Doctor, you were there early on warning about this. It's come to pass. Doctor, thank you very much. Democrats might want everyone to forget.